Imagine you're just walking and suddenly got sprained. It's because you step on an uneven surface or you roll your ankle unexpectedly. Getting sprained can happen all the time, especially in athletes. So we are here to present what is sprain all about. And we will also discuss what are the causes and symptoms and demonstrate on how to do first aid when getting sprained and how to prevent it.
A sprain is an injury of a ligament, a tough band of fibrous tissue that connects bones at a joint. Ligaments are a type of connective tissue and are tough, fibrous, and elastic. They connect bone to bone and help keep the joint together. They stabilize the joints during movements and prevent dislocation. Once a ligament is damaged by a sprain, the ligament is overstretched or torn, causing the injured area to be painful, swollen, bruised, and limited range of motion. Ankles, wrists, and knees are the common body parts that get sprains.
Sprain is highly relevant in the context of sports as this occurs through stretching or tearing up the ligament due to excessive or intense physical activities and quick movement. Athletes often experience getting sprains since sports require rapid jumping, quick reaction time and movement, and some include direct contact to other players which causes stress to the joint by having a bad landing and collision. Sports such as basketball, volleyball, soccer, and gymnastics are known for high sprain risks. Sprains are among the most frequent injuries in sports. Even mild ones can reduce mobility and affect performance.
Now, the classification. There are three types of grade of injury in sprain. Let us start with the grade 1. Mild. Ligaments are stretched but not torn. Mild pain and swelling. Grade 2. Moderate. Partial tearing of the ligaments, noticeable swelling, bruising, and difficulty moving the joint. Lastly, the grade 3. The most severe one. Complete tear of the ligament, significant pain, swelling, and joint instability often requires more intensive treatment or surgery. Here are some examples of real-life sports scenarios. Grade 1. Table tennis. Finger sprain. During a fast-paced rally, a player reaches awkwardly to return a shot and accidentally jams their fingers against the edge of the table. The finger bends the wrong way, causing a finger sprain, leading swelling, pain, and limited movement. Grade 2. Basketball ankle sprain. During an ongoing game, a player goes up for a jump shot near the free throw line. As they come down, they accidentally land on the side of their foot instead of flat, causing the ankle to twist inward. They feel a sharp pain and the ankle begins to swell. This is a classic ankle sprain caused by an awkward landing. Grade 3. Skating. Wrist sprain. While practicing a spin at the skating rink, a skater loses balance and falls forward. Instinctively, they extend their hand to break the fall, causing the wrist to bend backward with force. This results in a wrist sprain, leading to pain and difficulty moving the wrist.
A sprain occurs when a ligament is stretched or torn, typically caused by a sudden movement that forces a joint out of its normal position. Common causes include twisting or rolling a joint unexpectedly, falling or landing awkwardly, making sudden stops or changes in direction while running or jumping, and also receiving indirect impacts to a joint. Symptoms to a sprain often include pain around the injured joint, swelling, bruising, limited range of motion, tenderness when touching the area, and a sense of instability or the feeling that the joint might give up. In some cases, a pop sound may be heard at the moment of injury.
First aid and treatment. Now I will walk you through exactly what to do immediately after a sprain. The RISE method. RISE stands for rest, ice, compression, and elevation. The first step is rest. If you get injured, immediately stop whatever you're doing and avoid putting weight on the injured area. Rest is vital to prevent further damage and to allow your body to start healing. Second step is ice. Apply an ice pack to the injured area for at least 15 to 20 minutes every 2 to 3 hours. Third step is compression. You may use bandages or a handkerchief to gently wrap the injured area. This will compress and limit the swelling. However, make sure to not wrap the bandage too tight as it might cut off the blood circulation to that area.
For this demonstration, I will be using a handkerchief. Take the handkerchief and fold it into a triangle, then fold the point to the flat edge. Place the handkerchief strip over the injured area with one side being longer than the other. Use the longer side and wrap it up towards your hand. Then, once you reach your thumb, wrap it around the thumb. Tie the ends of the handkerchief on the top or the side of the injured area using a square knot.
The last step is the most important, elevation. Always raise the injured part above the level of your chest. This helps the fluids drain away from the injured area and it reduces the swelling. Use pillows to elevate the injured area, especially when laying or sitting down. After the initial care, we have long-term treatment. These measures are set to avoid re-injury and further damage. First is medication. Over-the-counter pain relievers such as ibuprofen can help with pain and reduce inflammation. Always check with your doctor if unsure. Second is rehabilitation. After a few days of resting, gentle motion exercises can help the joints remain flexible and avoid stiffness. In other cases, physical therapy may be recommended for serious sprains. Third is support. When doing any physical activity, use a brace or wrap your injured area to avoid any further damage. Fourth is medical evaluation. If weeks go by yet the pain doesn't get any better or doesn't fade, it is time to see your doctor. In some cases, these sprains resort into torn ligaments or fracture, sometimes needing surgery. And last is surgery. In rare cases, when the ligament is completely torn or it doesn't heal properly, surgery may be required. That is all for first aid and treatment for sprains. Next is prevention.
In preventing ankle injuries, there are two key factors, which is preparation and proper recovery. Preparation includes warming up, stretching, and strengthening the muscles around the ankle for better support. Recovery involves cooling down, resting, and addressing any discomfort early. Balance exercises can also help improve stability and prevent sudden twists or sprains. Preventing sports injuries begins with proper physical preparation. Warming up with light cardio and dynamic stretching prepares the muscles and joints for intense activity, while cooling down with stretches help reduce post-exercise stiffness. Consistent flexibility training improves range of motion and reduces the likelihood of strains. Athletes should also focus on rebuilding strength, flexibility, and conditioning, especially in the core and stabilizing muscle groups, to promote a balanced muscle development and protect the body during movement. Mastering proper form and technique under the guidance of a qualified coach further decreases the risk of injury caused by poor mechanics or repetitive injury.
Recovery, awareness, and health maintenance. Rest and recovery are crucial parts of injury prevention. Sleep and scheduled rest days give the body time to repair and rebuild, lessening the chances of overtraining injuries. Good hydration and nutrition help to sustain blood sugar levels, which, like your mineral levels, supports energy and muscle function and keeps yourself free from fatigue-related issues such as cramps, sluggishness, and poor reaction speeds. Equally important is learning to listen to your body. To the pain, discomfort, and fatigue are messages that should not be ignored. The sooner you stop or alter activity at the first sign of trouble, the less likely it is that a minor issue becomes a major injury. Regular sport health checkups will help detect potential problems in advance and provide personalized recommendations to stay safe and active.
That's all for our presentation. Thank you for watching.